Welcome back to Ageless Living. This is Dr. Tong Lee, and we've been talking about dark eye circles and healthy choices. Kurt, we talked about what the treatment for dark eye circles should start with causes, right?
Mm-hmm.
And there's some other more modern treatments, the newer ones with lasers, with the newer things, that in addition to treating the causes, we will get the dark eye circles looking better.
Which you can make an appointment if you want to learn more about it by making a phone call or go to azmdlaser.com, or the phone number again.
The phone number is 480-598-9733. Again, 480-598-9733.
So how does the laser technology work if they go down to the center?
I think that's, even though there are many treatments, we'll start with laser because I think that's the most popular one. People want quick fix.
Gotcha.
And the laser treatments for dark eye circles involve in two things. One is thickening the skin, because we know that's one reason why the darkness show, because the skin is thinning. So the laser treatment will resurface and heat the collagen and make skin thicker, and that way it blocks the view of the transparency of the skin that shows the pigmentation. So that's how it reduces the dark eye circles. Also, it causes some blood vessel constriction and will promote circulation and get rid of some of those toxins.
Wonderful. Now, here's what I love about azmdlaser.com, and you go set yourself an appointment and you get a free consultation. I went to one of those consultations, and while I was there, I asked the question, and I know this is way TMI here, but I had some varicose veins in my legs, and so I asked for laser treatments, similar, not the same, but similar for the legs, to get rid of varicose veins, or spider veins is probably the better term. And the advice I was given is spend $20, get some compression socks, and they'll probably mostly go away. And they mostly did. I was pretty impressed.
Your situation was mild.
Yeah, that's
so
true.
That's the most reasonable first step. You know, if it didn't help you, then you can pursue more aggressive treatments.
Sure. So that's what I love, is they're going to give you great treatment. So just because in other words, if you go in to sit down with Dr. Lee or with Dr. Robledo, and they make a recommendation, then you know it's the right recommendation. So the laser treatments, if that's the right thing for you, then you can feel comfortable that there's not another option. This is the best option at the moment.
That is the number one choice. There's another treatment that's called radio frequency. It does similar things to laser. It will heat up the skin and increase the collagen growth and thicken the skin, make the dark eye circles less prominent. So that's the two things I think most people ask the first, is like, what laser can we use? It's not necessarily the only one or the best treatment for it. In my opinion, the next two treatments are actually more effective.
Okay, but see, this is what I mean, open and honest.
Absolutely. And the treatment with filler, derma filler, and the most well-known one is probably Juvederm, can actually work quite nicely for dark eye circles and sometimes for eye bags and puffy eyes. And how it works is that the injection itself is it's no big deal. It's not very invasive, and it's done in a short period of time, and it doesn't require multiple treatments. One treatment would do for a good amount of time. It will last you 9 to 12 months, and the filler will thicken the soft tissue, will make the collagen grow, and will block the appearance of darkness. That's how it works.
Oh, okay.
And it's becoming more and more popular. It's done in many places. We do it too. We have a lot of experience in it. We actually call ourselves pretty much expert in it.
It's like reverse permanent makeup. That would be my very,
Yeah.
I'm doing that tongue in cheek. But in other words, yeah, the filler creates a little bit of a barrier.
Correct.
Mhm.
And the next one that I think is really, really, really good, amazing, because it has hardly any risk. The filler actually has some risk. Whenever you're injecting something in, it could be lumpy, it could, especially in inexperienced hands. The carboxy therapy, on the other hand, has hardly any risk. It does require a serious treatment, but it's so safe, it's worth it.
That's great.
That is, carboxy therapy means injecting CO2.
Oh.
That's what we breathe out, which is a very safe substance under the skin. How it works is it actually causes the blood vessels to dilate. The mild acid CO2 causes in the blood
Mhm.
will cause vasodilation and subsequent vasoconstriction, which helps you to get rid of the toxins, which also promotes circulation and stimulate collagen growth. So the CO2 injected quickly gets absorbed. It's because it's very absorbable in the blood. And that itself will immediately reduce the dark appearance immediately.
That's great.
Exactly. So carboxy therapy has been in existence for a long time. It's been used for wound healing,
Mhm.
like in cancer patients, diabetic patients. Sometimes wound healing is a problem. It doesn't heal properly.
Mhm.
So we try to use hyperbaric chamber. We try to use other ways to promote the healing. This is one of the ways.
What do you think of oxygen bars? Is that a little bit kooky? I mean, in other words, is it just something as interesting as just going down and
Yeah,
getting a cranberry juice?
this is interesting, yeah. There's a reason why in the air we don't have 100% oxygen.
Oh.
There's a reason nature made it this way.
Mm.
We have nitrogen, a lot of it in the air.
Okay.
There's only 21% of the oxygen. Why 21%?
Right. We tend to do okay with it.
If you
but-
breathe 100% oxygen for a long time, your actually small airways and the lungs will collapse.
Oh,
Because oxygen is completely absorbable in the blood.
okay.
So if in the little balloon inside your lungs,
Mhm.
oxygen's all absorbed, guess what? It's
And it
gonna
closes.
collapse. And this is why we have nitrogen.
Oh, to keep it
You
open.
know, the creator has a reason for everything.
You're right, which we both believe in.
Right. So oxygen bar is against nature. If you have a medical condition
Mhm.
that requires temporary increased oxygen concentration,
Then
absolutely.
it's right.
Absolutely, that's indicated and beneficial.
Mhm.
But for no reason to breathe pure oxygen, there's no benefit to
I
it.
never saw them catch on extremely. I mean, they were very in vogue in California, and then some of them traveled across here to Arizona.
Right, I
but-
mean, these people, I don't know if they had a medical problem, they have a temporary need of it, but for healthy people, there's no point.
I think it was a fad that was disappearing.
Right.
All right.
That
so-
goes back to
Mhm.
something good, doesn't mean the more you
Right,
take,
too
the
much of
better
a good
it
thing
is.
isn't necessarily a good
Exactly.
thing.
Oxygen is essential, but doesn't mean the more the better.
That makes sense. Well, thank you. This is why we love having Dr. Lee on the show.
Love
We
to
can-
share it.
You bet. Okay.
So, this is IDO, I don't know what that means. We talked about the treatments with carboxy therapy. We talked about using skin dermafillers for dark eye circles. And the next things are beauty sleep. We talked about
And it's real. Beauty sleep is real. Get your
Absolutely.
sleep.
the nutrition, what kind of things you take nutritionally that's good for that.